Welcome back. With large vaccination efforts underway in a lot of different areas of the country, there are still a group of people that have some questions about the COVID-19 vaccine.
And here to answer some of those questions and help people understand how it all works is Dr. Brian Curtis. Good morning, Dr. Curtis. Thanks for joining us.
Hey, good morning.
So tell us a little bit about how this vaccine actually works when it comes to everybody getting inoculated now and what that process looks like.
So our present process is really to make sure that we have a lot of equity to all those people we serve. And so what we've done is we've turned it into us outreaching to them. And so I'm old, so I remember trying to line up for concert tickets or call in for the concert tickets before computers, fancy computers. And so this removes that. And so what we've done is, first of all, the state of Illinois says the first 1B is over 65. And so what we did then was we went through our EPIC computer system, which is our medical records, and we risk stratified those 65-year-olds. And so we actually outreached to those that have 7 risk factors first, and then we've just gone down the line to 6, 5, 4, 3, 2, 1. And we're sending messages through EPIC. We're sending them emails. We are calling them, and we're sending emails. And instead of having to try to get hold of us, waiting in line, can't get through, because I've heard that a lot, we're really reaching out to people and getting them scheduled. And as of last night, we've given almost 3,000 vaccines between Peoria and Tazewell County.
And what is the strategy behind getting the vaccinations out?
So the real strategy, from our point, was really to target the people that are at most risk of getting hospitalized and dying if they got COVID. And so the first risk factor is being over 65, which we have over 20,000 people in Peoria County that's over 65 that we've identified within our health records. And so within that, then we went through and said, you know, you have diabetes, you're obese, you have hypertension, heart disease, you have stroke disease. You have all these risk factors that actually even make you more at risk for dying and getting hospitalized for COVID. So those are the people we wanted to immunize first. And we quickly moved through them, and we continue to move through our list very rapidly.
Dr. Curtis, one thing that we've been hearing even from some of our viewers is they've got concerns about symptoms after taking the vaccine. What has been working so far with it? Are there concerns with other things that have not been working with it?
So really the biggest thing about it is that you cannot get a vaccine 14 days before or 14 days after the COVID vaccine. And so most vaccines for over 65 are going to be the pneumonia shot and the flu vaccine. And so if you've had the pneumonia shot and the flu vaccine or any other vaccine, you cannot get the COVID vaccine for 2 weeks. If you got the COVID vaccine, then you cannot get another immunization for 2 weeks after. And a lot of it has to do is it just has not been studied with other vaccines being given around the same time period. So really that is the big thing that we have seen, and we've been answering that question quite a bit.
Well, a big talker right now is the distribution of the vaccines. Do you believe our local hospitals, our health departments and all that, are they receiving enough vaccines to meet the demand from people out in the community right now?
I don't know anybody that's getting enough vaccine throughout the country if you watch it. I will say, though, that our local health departments, Peoria, Tazewell, Woodford, they are on the ball. They have a great plan, and they're doing a great job. And I'll tell you, they've really worked well with the big local health systems here, and we're working well together. And so I think our process here has worked well. I know you see other places where it hasn't worked well, but you know, our bamlanivimab infusion has done really, really well. We've given over 1,000 doses of that through our system, and we've rolled out this vaccine. And I tell you what, the mission partners here at OSF have stepped up. We have everybody working 12, 13-hour days with a smile on their face because they're so happy to be able to give this to people.
All right, and we are so grateful for them and all of the hard work and keeping our communities safe. Dr. Curtis, thank you so much for your time. And of course, if you're looking for more information, we will be sharing this interview over on our website, ciproud.com.